Parts of National Public Health Reference Laboratory at Korle Bu have been gutted by fire, with the archive office, accounts and administrative offices among the affected areas. The blaze, which broke out in the early hours of today, sent thick smoke billowing through the facility, prompting an emergency response as officials assess the extent of damage and its potential impact on critical public health services. Collins Frimpong is our man on the ground and joins us live with the updates. Collins, what can you report?
Here at the National Public Health and Reference Lab at the Korle Bu Teaching Hospital this morning, the information that we picked from the ground suggested that the incident occurred around 10 p.m. yesterday, and fire service have been here trying to contain the fire. I have the chief fire officer here that I want to engage. Please, good morning.
Good morning.
So far, we heard the incident started around 10 p.m. yesterday. What was the initial assessment and what's the full breakdown?
Yes, when you came here, you see, we finished quenching all the fire. And there are pockets of fire, so we are trying to cool it down. We got here by exactly 12:15, 12:30 thereabouts. We were able to put the fire under control. And I learned to the Office of the Records and Public Health and Reference Lab. And we were able to contain their library, but for the accounts office, their stores, admin and lab, it's totally down. It was close to the diabetic center. That place too, we were able to salvage and there was no problem there.
So far, what are some of the specific items do we know have been destroyed so far?
Laboratory items, books. For the accounts, I don't know, we couldn't retrieve any money, but then the accounts office was involved and the lab too, so we realized the lab too, they have some materials that were also involved there.
Do you know what really caused the fire?
No, we have to investigate first. We can't make a hasty conclusion.
But are we assuming?
We can't assume. For fire service, you don't assume. You make sure you say the right thing. So we'd have to give us time to finish the investigations and then get back to you.
So far, going forward, what are we going to do here? I mean, what is the next step of action?
Yeah, the next step, we've asked that they should bring a tape so that we sell a tape around the place so that nobody goes around the area. It could collapse, so we advise that nobody goes around the area whilst our men try to work on it.
I'm grateful to you. So this is what is currently happening here. This particular building is the National Public Health and Reference Lab at the Korle Bu Teaching Hospital. And as you can see for ourselves, we can see that what we've been informed, what we've been told is that this particular building houses a number of stores for the laboratory and also some laboratory items. There is also an account office in there that, according to the Ghana National Fire Service, they couldn't salvage anything from that particular building. There is also a laboratory, a science lab over there where we went there and we've seen that they are trying to get some of the items, including books, from the area. But right from here, from the stores and also some of the laboratories, you can't pick anything from here. I can see a lot of A4 sheets here. Prof, we've been here, we've assessed the situation here. So far, what information are you picking on ground when you came here?
All right, so it is really a sad situation, and we are working closely with the fire service, the leadership, the people on the ground to make sure that the fire doesn't extend to other areas. And then we leave the fire service to do their job so that at least we can ascertain the cause and then put the necessary measures to prevent such issues from occurring in future. Right now, it's too early for us to be speculating. Right now, the most important thing to us is for the fire service to get this situation under control, and then we will revert.
So far, since you came, have you heard of some of the departments? Have they told you about the department that got burnt and also the items that have also been burnt?
Yeah, so We have the accounts department. We have some of the places where we have our books, the general administration, the stores, and of course, there are a lot of things that we are not able to quantify yet because some part of the archives to have been burnt, and we just waiting to have a comprehensive report of the rest of the places so that we can take a decision.
So going forward, right from here, they are supposed to work. We can't just leave them idle. What is the immediate solution?
As I said, this is something the fire service is going to recommend. They will take care of that part, and I will take care of the Ghana Health Service component. That's the human resource and reallocation plans and all that. Once you have this situation, you move into the field with a plan to reallocate people. So we've already identified a place where the people will be sent to. The good news is there are no casualties. So we are extremely grateful that we don't have anyone who got himself burnt. The rest will be to relocate them. And we've created space over there to make sure that people get relocated and nobody should be harmed.
Are you saying that there was a casualty?
I said no, no.
All right.
I said the good news is that we did not, and there is no casualty. And that is extremely good news to us.
I'm grateful to you. Thank you. All right.
And that's Collins Frimpong interacting with the Director General of the Ghana Health Service, Professor Samuel Kaba there.